Welcome everyone to an exploration of urban health challenges and opportunities. Today we embark on a journey guided by data collected by the National Council of Urban Indian Health, offering valuable insights into the landscape of healthcare for urban Native American communities. So we're going to start by navigating, oops, that's my mistake, by navigating the terrain and challenges and opportunities. So let's go ahead and launch our first poll question just to see who we have in the room. All right, so which type of facility do you work with or represent within the urban Indian health landscape? All right, we have a lot of others, and I would love for the others to put what type of facility they work for in the chat box if possible, just so we can get an idea. Right, a couple more seconds. Okay. All right, we got one full ambulatory. All right. I think we can end our poll here. So it looks like we have a lot of others are not applicable in the room and a one full ambulatory. So that's good for me to know. So just to kind of understand who we're talking to and how we can divulge this information that we have today. So thank you so much for participating. And if we could go ahead and launch poll question 2 before we get into the slides. All right. So have you or your organization faced challenges in accessing STI and HIV prevention and treatment services? So yes, no, unsure. All right, we have one unsure. Yes, okay. No, all right. So good mix, okay. No, all right. Give it a couple more seconds. Awesome. So those who did answer no, I think when we have our open forum, we can definitely have that opportunity to provide your solutions, your best practices when it comes to navigating access for prevention and treatment services. So definitely we'll be leaning on you to provide some great information. Thank you so much. Yeah, so we have a good mix of yes, no, and unsure. So yeah, we'll definitely get to that when we move forward. Awesome. Great. So, exploring challenges and opportunities within urban Indian health, we turn our attention to the insights directly from our UIO facilities. So, these establishments serve as frontline providers of healthcare services to American Indians and Alaska Natives in urban areas and offer firsthand perspective on STI and HIV prevention, screening, and treatment. Through rigorous examination of insights from UIO facilities, we glean valuable observations into prevailing challenges and emerging trends. The diversity of perspectives represented within these insights provides a nuanced understanding of the multifaceted nature of STI and HIV care provision within urban Indian health. We uncover critical barriers hindering the delivery of STI and HIV services, ranging from limited resources and funding constraints to systemic challenges in accessing and implementing comprehensive care strategies. And moreover, the identification of areas for development and enhancement underscores the commitment of UIO facilities to continually improve their services to meet the evolving needs of their communities. Analyzing the insights from UIO facilities, we not only acknowledge the challenges, but also recognize the resilience and determination inherent within these organizations. Insights serve as a catalyst for meaningful dialogue and action, guiding us towards innovative solutions and strategies to bridge the gap in STI and HIV care provision within urban Indian health. In the subsequent sections of our presentation, we will leverage these insights to inform our discussion on fiscal fortitude, service disparities, and cultural competency, paving the way for a more equitable and effective approach to STI and HIV prevention and treatment within urban Indian health. All right, so let us delve into the screening and treatment services offered by UIO facilities encompassing both STIs and HIV. All right. So these are areas of interest for enhancing services. Again, it's coming to partner STI services. Oops, my computer just fell back. Partner STI services and HIV prevention resources, I should say. And then the service offerings that come from our UIOs directly as on-site STI screening and testing, specifically for hepatitis C and HIV, additional types of testing services for other STIs, clinical management for various STIs, appointment availability, so same day or walk-in care, and then specific HIV services, so for on-site screening, free sliding scale services as well. So on-site screening and testing services serve as a critical tool for early detection and prevention efforts, as you all know, and these services ensure that individuals have convenient access to screenings without needing to travel far from their communities. UIO facilities offer a range of screening options, including commonly available tests for hepatitis C, as well as HIV screening and testing. Moreover, the clinical management for various STIs and HIV is provided by UIO facilities, ensuring that individuals diagnosed with these conditions receive the necessary treatment and support to manage their health effectively. Then appointment availability is another crucial aspect of STI and HIV care. UIO facilities prioritize access to care, offering same-day appointments or walk-in care options, ensuring that individuals can receive timely screenings and treatment without facing long wait times. However, there are opportunities for improvement in expanding care access to screening services further. While UIO facilities offer on-site screenings, there's a potential to explore additional methods such as providing self-collection kits for genital and or extragenital specimens. And these kits could be distributed to individuals who may face barriers to accessing traditional healthcare facilities, thereby increasing access to screening services. So in summary, UIO facilities play a pivotal role in providing screening and treatment services for STIs and HIV within the urban Indian community, and prioritizing access to care and exploring innovative solutions. We can further enhance STI and HIV prevention and care, improving health outcomes for urban Indian populations. So some future needs and interests. So as we look ahead, it is crucial to address the future needs and interests within the realm of STI and HIV prevention and treatment among Indian health organizations. Despite the progress made, there remains significant challenges that warrant attention and proactive measures. One notable area of focus is enhancing services to meet the evolving needs of the urban AIAN community. This includes not only improving existing STI and care, but also prioritizing HIV prevention and treatment efforts. Partner STI care and HIV prevention and treatment emerge as key areas of interest among UIOs, reflecting a collective commitment to addressing the multifaceted health needs of the community. Moreover, there is a growing recognition of the importance of cultural competency and inclusivity in healthcare delivery. So UIOs are increasingly seeking resources and training opportunities to ensure that services are culturally sensitive and responsive to the unique needs of AIAN individuals. So in conclusion, UIOs play a vital role in addressing STI and HIV health disparities within the urban AIAN population. While challenges persist, there is a clear commitment to enhancing services and improving outcomes. So by prioritizing partner STI care and HIV prevention and treatment, UIOs can make significant strides towards mitigating the impact of STIs and HIV on the community's health and well-being. So to move forward, it is imperative that stakeholders continue to collaborate, advocate for resources, and implement evidence-based strategies to strengthen STI and HIV services within UIOs. By working together, we can create a future where all members of the AIAN urban community have access to comprehensive, culturally competent care, leading to improved health outcomes and greater equity in healthcare delivery. All right, so navigating the urban Indian health landscape. So again, what is the mission of NCUIH? We're here to support our urban Indian health organization. What is the purpose of UIOs? To provide this types of care. And again, we looked at the types of UIOs that are in the room today, but again, we also understand that there are different aspects of care that these types of UIOs are able to provide. So within this framework, we find a diverse area of urban Indian health organizations, each with its unique mission and scope of services, from full ambulatory facilities to outreach and referral centers offering case management and behavioral health counseling, and the spectrum of services provided by these organizations is vast. And as we navigate through these intricacies of urban Indian health, it becomes apparent that these organizations are not merely healthcare providers, but essential community resources. And they serve as hubs as support, cultural preservation, and empowerment, fostering resilience as the well-being within the urban Indian population. So in our exploration of STI and HIV prevention and treatment, it is imperative to recognize the pivotal role played by these organizations in addressing the unique healthcare needs of urban AIN communities. And by understanding their unique mission, structure, and significance, we lay the groundwork for a nuanced and informed discussion on enhancing STI and HIV services within these vital healthcare entities. Taking a look at service disparities and comparing what UIOs offer and their interests of improvement. Can we launch poll question 4, please? 3 or 4? 4, please. Right. So have you ever participated in cultural competency training related to STI and HIV prevention and treatment? Okay, we got 1 no. Not sure. Okay. Got 1 yes, 2 no. All right. Okay, it looks like we have a lot of no's. Okay. Let me go ahead and end the poll and share our results. So it looks like we have a lot of people in the room that haven't participated in cultural competency training, and that's okay because there are a lot of trainings that are offered on that that we can definitely provide resources to, and a lot of them are free. A lot of them have are provide CEUs as well. So definitely there is an opportunity for those in the room to be able to take these cultural competency trainings to improve the types of care that they provide. Great. All right. So kind of looking at this table, these are for answers directly from our UIOs in what they offer specifically within their facilities and where they're interested in improving. So again, when it comes to STIs, chlamydia, gonorrhea, syphilis, HIV, patient sexual health history data. So a lot of these screenings are very, very stigmatized, and the treatment is also stigmatized because, again, something when it comes to STIs, we have a lot of stigma around them, whether it's within the community or even within a healthcare facility. People are a little apprehensive when receiving this screening or treatment. So their cultural competency training really, really helps when providing these services, because you want to be able to understand the person that you're working with and be able to be helpful to them and be able to have that cultural competency to provide the services to them in a way that they're comfortable in receiving them. So everything that is offered by our UIOs, there's an interest in improvement, which is a great thing because we're always trying to improve our services. We're always trying to make sure that we learn, from our patients and from our community members, and making sure that the care that we provide for them is tailored to them and, it is sustainable as well. So, in assessing this landscape of STI and HIV services provided by UIO facilities, it is essential to identify areas where improvement is needed. So looking at the table, we observe that all services offered by UIO facilities have indicated a keen interest in improvement. This demonstrates a proactive approach towards enhancing STI and HIV services to better meet the needs of the urban Indian community. And then moreover, critical services like HIV treatment and partner STI services have indicated significant interest in improvement, underscoring the importance of advancing these areas to address the evolving needs of the community effectively. So in summary, this comparison highlights commitment of UIO facilities to continuously improve STI and HIV services, and by identifying areas for enhancement, we can work towards building a more comprehensive and effective STI and HIV prevention and treatment programs within urban Indian health. So cultural compassion, so this is going back to that cultural competent care. All right. So again, in this section, we explore how tailoring STI and HIV services to cultural context of the AIN community can enhance effectiveness and trust. So that's why I asked the question to see, has anyone taken that cultural competency training before? So one tangible example is integrating traditional healing practices. I know that's been a very big conversation within the UIO space. So integrating traditional healing practices alongside conventional or Western medical treatments, which by honoring cultural beliefs and values while providing holistic care. Additionally, providing language access services, again, that's something that's very big, ensuring that STI and HIV education materials and healthcare services are accessible to AIN individuals who may speak, Indigenous languages as well, or, may feel comfortable receiving services within that Indigenous languages. So offering materials and counseling in, the Navajo, Cherokee, or Yupik, fosters better communication and inclusivity, particularly in discussing sensitive topics like HIV prevention and treatment. Engaging with tribal leaders, so speaking to your community members and key stakeholders, the elders and traditional healers in program development ensures cultural relevance and community buy-in. Collaborating with these community leaders informs the design of culturally appropriate interventions, fostering respect and responsiveness in addressing both STI and HIV health disparities. And finally, cultural competency training for healthcare providers enhances their ability to deliver respectful and effective care. And by educating providers about AIAN history, beliefs, and communication styles, we foster a more inclusive healthcare environment. And these strategies demonstrate the importance of cultural compassion in addressing STI and HIV health disparities among AIAN populations, promoting better health outcomes and well-being. So access amplified, strategies for enhanced care delivery. So this is where we get into the nitty-gritty. So in this section, we will explore tailored strategies aimed specifically at enhancing access to care for AIN community members, including those living in underserved and maybe even remote areas. So implementing telehealth services, if that's something that's, or the UIO or the organization has the ability to provide. So customized to the unique needs of and preferences of AIA and individuals, allows them to access STI and HIV consultations from the comfort of their homes or local community centers. This approach respects cultural norms and traditions while also improving access to essential healthcare services, including HIV treatment and counseling. Additionally, establishing mobile clinics and specifically target communities ensures that healthcare services are brought directly to those who may face geographical barriers or limited transportation options. These mobile clinics can travel to tribal lands or other remote areas, offering comprehensive STI and HIV testing, treatment, and education in culturally sensitive environments. And that also, applies to the urban Indian space. So going to a place that is a safe space for community members, reaching out to them in a way that they feel is, respectful and trustworthy, instead of having them come to the clinic. Establishing those mobile clinics and mobile outreach opportunities is something that is really, really helpful. Community-based outreach initiatives also are another option as well. So that are, events that are culturally relevant, led by AIA and community members themselves, can effectively raise awareness about STI and HIV prevention and treatment. And by partnering with tribal leaders, elders, and cultural organizations, we can develop and implement outreach programs that resonate with values and beliefs of the AIA community, thereby increasing engagement and trust. And lastly, provided dedicated assistance with navigating health insurance options tailored to the specific needs and circumstances of AIN individuals, ensures that financial constraints do not hinder access to vital STI and HIV services. So this could involve offering culturally appropriate guidance on insurance enrollment, explaining coverage options, and addressing any concerns or questions related to healthcare access. And by prioritizing that cultural competence and community involvement, we can ensure that all members of the AIN community have equitable access to high quality care. All right, so conclusions. As we continue to examine STI and HIV care, it's evident that there are several key recommendations to consider for enhancing services and improving outcomes. Firstly, addressing barriers is paramount. By securing additional funding sources, UI facilities can expand resources for comprehensive services, ensuring access to wider range screening options and treatment options for urban Indian populations. Collaboration is essential. Secondly, UIOs should seek to forge partnerships with local health departments, if you haven't already, and community-based organizations to leverage resources and expertise, fostering more coordinated and effective STI and HIV prevention and treatment efforts. Investing in culturally tailored outreach and education initiatives is crucial. Providing culturally sensitive information and resources, UIO facilities can combat stigma and empower individuals to prioritize their sexual health, thereby reducing the prevalence of STIs and HIV within the community. And additionally, the utilization of telehealth, adopting a data-driven approach is also essential. Prioritize data collection, evaluation mechanisms to monitor service utilization, patient outcomes, and satisfaction levels as well. And implementing all these recommendations, UIO facilities can pave the way for a more comprehensive and responsive approach to STI and HIV care within urban Indian health.